I'm Dr. Sridhar. Welcome to my channel. I hope you are enjoying the videos that have been shared so far. I have a request. Please do subscribe to the channel, as your subscribing motivates me. And please do like and comment on the videos as possible. So this MCQ is related to prolonged jaundice. So which of these statements is correct regarding prolonged jaundice, where we have jaundice persisting after 2 to 3 weeks? So a level of say 8 to 10 milligram % persisting after 3 weeks in a term baby on breastfeeding, or after 2 weeks in a baby on formula feeding, can be considered prolonged jaundice. So if a baby is exclusively breastfed, this is most likely breast milk jaundice, and if we have a normal direct bilirubin, we continue to breastfeed and monitor. The second choice, it's important to briefly stop breastfeeds and start formula to reduce the jaundice, even if direct bilirubin is normal. The third choice, we don't need any blood test to review, as the baby won't be at risk of brain injury at this age. And the last choice, start phenobarbital to reduce jaundice as it is persistent. So I'll pause for a few seconds. Okay, so the answer is obviously A, because if the baby is exclusively breastfed, this is most likely breast milk jaundice. It's very important that we check the bloods and make sure the direct bilirubin is normal. Also make sure that the thyroid function was part of the newborn screening and that is normal as well. So make sure these two components are normal, and even if the bilirubin is like 13 to 15 milligrams, continue to monitor. I normally suggest repeating every 2 to 3 weeks till it becomes below 5 or so, and the direct bilirubin should be continued to monitor at each visit as well. You don't need to worry about the milk. Continue the breastfeeding. The bilirubin at this range of 13 to 15 milligrams doesn't harm the baby in any way. Reassure the mother. I've seen a few babies where it continues at this level even for 6 to 8 weeks, and then it drops and becomes normal by 3 months. The stool color is an important factor. It should be yellow or green. It should not be pale stools. So pale stools are not normal. Always educate the parents to look for that. The second point about stopping breastfeeding, sometimes if the bilirubin is approaching an exchange level or it persistently stays above the phototherapy level, you may consider a small period of expressing and storing the mother's milk while you give formula. But this happens very, very rarely. Breast milk jaundice is very common. About 15% of the babies may have when they're exclusively breastfed, while this stopping the milk will be needed in say less than 0.5% of such babies. So please don't think about this as an option unless you are really stuck and it's a high level persistently. And when we say high level, it's not in the range of 13 to 15, it's in the range of 20 and above, which is either needing treatment with phototherapy or repeated admissions for phototherapy. And again, please remember that the babies are low risk, and you can follow the American Academy charts for that age, and the chart doesn't extend beyond the certain age, but you stay with the same line. The third point is wrong, because we do need a blood test to make sure the direct bilirubin is normal. Without that, you cannot reassure them, and you may have a risk of missing biliary atresia or neonatal hepatitis, both of which are serious conditions. In biliary atresia especially, the timing of treatment is important, so you should find and treat it quickly. Phenobarbital is not a treatment for prolonged jaundice. It's only used in situations where it's a persistent high level, like Krigler-Najjar type 2, for example. So don't consider phenobarbital. It's not a safe drug. Even in seizures, we don't advise using it as the long-term drug, because it can cause cerebellar atrophy, and also it affects the neurodevelopment. So don't use phenobarbital as a treatment. The jaundice doesn't harm the baby. Just continue monitoring, as I mentioned earlier. And I hope you like this, and please do like, share the video as well.